these infections account for almost for more than 1 million deaths on the continent every year.
Let me come to Sophie Mkwena again, and Sophie is with SABC. She's the foreign desk editor. Do we have enough protective clothes for health workers in Africa?
We are working very hard in a coordinated manner to make sure that what I call the commodities required for the response spectrum are met. The response spectrum includes the prevention arm, the treatment arm, and the harm arm. So I think we are at a better place than where we were several months ago because of we're trying to unlock the supply chain system there, for personal protection. But as I said earlier, we have to be very deliberate, and this is a message to all member states. We have to be very deliberate in protecting our healthcare workers because these are the people that protect us. These are the front line. When you talk of the harm to the HIV, TB, and malaria programs, if these people are infected and they die, that becomes a very, very complicated situation to handle other infections. So we are working very hard to ensure that the supply chain management for these commodities.
Ian Panel of ABC News. There are dire warnings about an exponential increase in cases in Somalia. What is your estimate of the situation there? Why is it so bad? And Somalia's ability to handle a major outbreak?
We all know Somalia is going through, continues to be a country that is challenged with the instability there, and instability and fighting a disease do not go hand in hand. I think that much we should recognize, that it becomes a fertile environment for the virus to spread and spread rapidly. We should always remember that. Just to use the analogy in DRC, we have been fighting Ebola in North Kivu for the last 2 years, and the reason is because of the insecurity that exists in the region. So once you have insecurity in the region, you expect to have challenges in fighting. It becomes tougher to fight the virus in there. So we are very concerned with the situation in Somalia, and we cannot resist getting concerned. But we are here as Africa CDC to lend all support to the government of Somalia to fight this outbreak in the most appropriate way. WHO is also in a situation to support, and many partners. So we just need to coordinate our efforts more with the government of Somalia.
We have a question coming in from Michael Omare from Tunacheki. And Michael says, how long do you recommend governments on the continent to keep their lockdown and curfew measures?
So we are actually in the issue of issuing guidance on how to ease up lockdown. And hopefully by next week, those guidelines should be out. But once we issue that, I think it's really up to the countries to take those guidelines and then customize it in their context, the local context. It's very important to do this because, you cannot issue a blanket recommendation to all countries. They should be looking at a stepwise approach in unlocking the system so that people can continue to, of course, ensure that the livelihoods are protected and the lives are protected. So it's always a balance between saving lives and livelihood of the continent.
Thank you. Della Russell of the Daily Graphic in Ghana says many African countries that implemented lockdown restriction programs to halt the spread of COVID-19 have had to back down on the arrangements due to the economic impact it was having on vulnerable households. In Ghana, we have seen the restrictions being lifted. However, cases have seen exponential rise in the last few days, pushing the numbers to a little above 3,000. What will be the Africa CDC's recommendations for economies such as Ghana and others that may be in a similar dilemma?
That's a very good question, Dila. We are observing the situation in Ghana as in other countries very closely. And that's what I said, that the balance between saving lives and the livelihoods is a delicate balance. But that we have to also know that we cannot continue to lock down our economies forever, but we should really take the opportunity that countries are under lockdown to intensify public health measures, which we have outlined, which is all guided by the PAC strategy we are putting out there. So the government of Ghana has to intensify the ability to test people, detect the cases, isolate them. I mean, that's the only way you win this virus. We don't have a vaccine for the virus. We don't have treatment against the virus. So public health measures, intensifying public health measures is the key to unlocking. And you unlock in a stepwise manner and monitor the situation. And if certain communities are more affected, you re-implement certain measures that will help to contain them. I think that's what our guidance will be suggesting to member states.
Let me come back to Maren Sabo from Norway. 2 questions. How can the outbreak of COVID-19 affect people struggling with diseases such as HIV and tuberculosis? This is 1. And 2, given its history with recent outbreaks, are there any lessons here that Africa can provide for the rest of the world?
It's clear that we are all very concerned as a continent that COVID is coming at a time that we are still challenged with HIV. We're still challenged with TB and malaria and other diseases. So I think this is all but going to make it more challenging for us to fight other diseases that have been on the continent because of the limited resources and fragile systems that the countries in Africa have. So, and that's what we're saying. We will be advocating for these programs to be protected as much as possible, and working with UNAIDS and other organizations to make sure that these programs remain on the radar of many African governments. With respect, so with COVID and HIV, because of the limited data that we have on the continent as of now, with respect to the 2,000 people that have died, we need to analyze the data and understand who was infected with TB, who was infected with HIV and malaria, and what the underlying cause of the death was. So I think that is an analysis that through the joint coordinated strategy and platform, we will generate a little bit more data. The second question was about...
Are there any lessons?
Oh, the lessons, yeah, Len. There are a couple of lessons that not necessarily for COVID, but for general response to disease outbreak that the continent of Africa can offer. One is the community response and strategy. Countries like South Africa are doing exceptionally well in fighting the COVID-19 because they are using the extensive experience that they had and had acquired from HIV programs to mobilize the community and make this and orientate the response towards a community ownership, leadership, and response. I think that is very important. Second is that you see countries like Liberia, Sierra Leone, and others using the experience that they had in contact tracing, using foot soldiers during the Ebola outbreak to actually deploy or redeploy that same strategy to supporting their response strategy. So in the whole PAC concept, the partnership to accelerate COVID testing, we believe that countries like Sierra Leone, Liberia, Guinea will actually use that expertise that they acquired a few years ago to bring that to bear. And these are not things that you easily see across many countries outside. The third thing is the strong political leadership. The leadership, the political leadership at the level of the African Union Commission and the AU under the leadership of Chairperson Moussa Faki and the President of the African Union, President Ramaphosa, has been extraordinary. The fact that the head of states have met in sessions to discuss this extensively for the last couple of weeks, almost on a weekly basis, speaks to the strong political ownership, leadership, and will that the continent is paying to this crisis. They are seeing this as a serious health crisis, a serious security crisis, and a serious economic crisis. So these are all lessons that other parts of the world can learn from Africa.
Thank you, John. I just want to acknowledge two questions, but you've already answered them. The one is from Pamela from Channel Africa. Thank you, Pamela, for writing in. And she was asking about the Madagascar herbal remedy. And also Mara had another question on malaria and other diseases. But those questions have been taken already. Let's go out with a question from Getachew Tedler, Haley Georgios, and he's with Deutsche Welle. And he says, the Africa CDC and Africa 50, what is the difference? And how do they cooperate to harmonize their mission? And he also wants to know about the actual situation on the continent, but I think you've given that already. But the next question is how to get out of this vicious circle.
Let me start with the last question. How to get out of the vicious circle is exactly what we are proposing. There's, the gateway to ending this severe pandemic on the continent is through the PAC strategy. We have to go back to basics and apply basic public health measures in the absence of a vaccine, in the absence of treatment, which says we have to track people, test them, trace them, and treat them. If we do this consistently and apply ourselves to it with the resources there, it will be tedious work, but it is the formula for us to win. We're calling on Africa as a continent to deploy over 1 million community workers, and the head of states and governments have already issued a decision about 2 years ago that talked about deploying more than 2 million healthcare workers. I think we should tap on that, to use that decision and move quickly and support the PAC strategy that we all, that the African Union, with the endorsement of the Bureau of Head of States, is putting forward. It captures everything. The second thing is the Africa CDC, the difference between Africa CDC and Africa 50. The Africa CDC is the specialized technical institution of the African Union, which was launched in 2017. It's also good to know that the Africa 50 is actually supporting, has made some resources available to support the Africa CDC's efforts to fight COVID. So I think the two are working in a very, very complementary fashion. And we, as a continent, I think the vision and the wisdom of the head of states to have established this specialized technical agency in an accelerated manner in 2017 speaks to the impact or the return on the investment that they are seeing now based on that concept, which is part of implementing the Agenda 2063, which I don't think people give enough credit to it the way it should be. I think they committed to establishing the Continental Free Trade Agreement is done. They committed to establishing an Africa CDC is done. They committed to establishing the African Medicine Agency is in the course of being done. I mean, countries have signed up to it, and it just needs to be rectified. So I think I say this to make a difference with the question the journalist asked about the Africa CDC. It's a young organization, but born out of the wisdom and the vision of our head of states.
Thank you very much, John. We've run out of time. Our 45 minutes is up, but this has been a very, very important press conference. We've had a lot of questions, and we want to thank our colleagues in the media for continuing to cooperate with us and for taking messages on COVID-19 out to our most important constituents, who are the African people. Let me also thank all of you who've been watching us on Blue Jeans and those who've been watching us on live stream. A special thank you to the South African Broadcasting Corporation for taking this press conference live. Join us again next week at the same time.
Thank you. Thank you all, and see you next week.
Quite an important conversation there, and very pertinent questions asked by journalists from all over the continent, including criticisms of the responses of Tanzania and the supposed miracle cure that could be coming from Madagascar, and personal protective equipment, and so on and so forth. We'll continue to unpack that conversation later with our foreign editor, Sophie Mkweli. say goodbye to our SABC 3 viewers now as we continue with the agenda. Let's take a short break.